The company's been around for about 16 years, and it really literally grew out of need. 16 years ago when we started the company, it was simply to promote a doctor's office, and that's simply why we were calling companies and saying, can we have a doctor come out and do a wellness lecture? And nobody could believe that a doctor would come out of their office and do a wellness lecture for a company. And 16 years ago, there was no such thing as on-site biometric screenings, our doctors talking at offices for their employees or health fairs. So all this came about just simply as a need. And so when one company realized that we would do this, they started telling their other companies, friends that were HR and benefits people, and then finally it came down to a broker that happened to be talking to a company that we did a wellness program for, and all he heard was Kaiser, and he wanted to know who we were. So he called me up, and he thought I was Kaiser Insurance. So you can imagine him roll huffy and puffy like you're trying to take my company away. And I was like, well, no, not at all. We provide, and I told him everything that we did, and he just thought we were just his best friend from that point on, because he realized the importance of it because of the fact of insurance claims going up at the time. And eventually it's come to this point where now we're dealing with Obamacare, and there's health and wellness programs and companies popping up left and right. The main thing that I do want to say as far as that is just make sure that if you as a broker or the company that they're utilizing is to make sure they are a true wellness program provider, in the sense of their health, their MDs, their DOs, they have a true wellness background. Because I've had some companies call me and ask me about different companies, and they were really like marketing companies, in the sense of whenever they threw a health fair, it was Dell Computers there, Target, and stuff like that. It wasn't really somebody doing biometric screenings or blood work or blood pressure or vision screenings and so forth. So I've been called in regards to those types of vendors, or so to speak. But as far as a little bit about Kaiser, again, we've been around for about 16 years. We work directly with companies. We also work directly with insurance carriers and also insurance brokers. We get calls from those three aspects to do some type of wellness program for a company. The services that we do are anything and everything that has to do with corporate employees, and so anything from blood work and flu shots to health and wellness fairs to corporate massage days, vitamin shot clinics. Believe it or not, that is the most popular one right now, is the B12 shot clinics. And we get so many calls. Just in San Antonio, we do over 200 on-site clinics a week for companies that their employees are wanting B12 shot clinics. And but we also do fitness assessments, health assessments, and so forth. Yeah, everybody, they're like, sure, come on over. It gets the employees really excited and happy. But as far as what is a corporate wellness plan, it's really different to every company that I've ever dealt with. There's times that I've had a company that simply all they do every single year is a health fair, and that's it. Once a year, hope it stays with you for 365 days, and we'll come back around next year. And then I've had some companies simply use this for wellness lectures, and that's all they do for their employees is maybe once a quarter do a wellness lecture on diabetes or cancer or nutrition and so forth, and that's it. But then there's some companies that we've done programs for across the board that utilize every aspect of what we do. So, but a true wellness plan is one that incorporates the dimensions of every single aspect of an employee that has to do with their emotional, social, intellectual, spiritual, mental, financial, physical, occupational, environmental, medical. That is what it encompasses the entire entity of the employee. But again, every single company I've ever dealt with in 16 years all have their idea or their budget or what they're willing or wanting to do for their employees. And I'm sure that y'all dealt with that as well. As far as where to get started, before even beginning to talk about a corporate wellness plan, there needs to be a management staff or a committee on site that actually is responsible for overseeing the following, identifying areas that they could use improvement. Usually that would involve maybe the benefits person that oversees the insurance claims of some sort, that they could kind of see, okay, well, this is the area that we have issues with, that we see a lot of claims on, this is where we need to focus, and then go from there. And a perfect example is we did a wellness program for the United States Post Office many years ago. And when you walked into the United States Post Office in San Antonio, it's a very large building that absolutely has no windows whatsoever. It's very dark and gray, and you can imagine why they go postal. So they had a cafeteria that the minute you walked into the cafeteria, you could just smell and feel the oil that's in the hamburgers and french fries and hot dogs that they were feeding their employees. And there was two things that was going on with that location at the time. One of them was that they had a very high cancer rate, meaning that they had 4 employees die of cancer that year. They had 3 of them that were going through chemos and dealing with cancer issues. So it was pretty high for just one location dealing with just the cancer issue. The other one was the fact that you would think a post office worker would be a very healthy person because they walk, but they were actually the total opposite. They had one of the worst cholesterol levels and blood pressure, and they were just stressed out employees. So after we went through the wellness program and gave them back their assessments and so forth, the very first thing that United States Post Office did was they yanked the entire cafeteria out. And they basically let go of the people that were cooking up french fries and so forth, and they installed vending machines. And nothing but healthy products were in these vending machines. And so if the employee didn't want to eat that, they were going to have to bring their own food, or they had to leave the premises to go eat whatever type of food they wanted. That was the very first thing that they did. The other thing that they did was they assessed the air in their building, and they found out that the machines that were being used to get the letters from one area to another, after a while created a black substance that dissipated in the air. So the employees were breathing this substance, and it was not ventilating very properly. So that was another area that they fixed as well, because the ventilation in that building was horrible. It was an old building. They didn't change out the vents very often, and this black substance was being put into their body, which was probably one of the reasons. They never ever claimed that it caused the cancer issues, but for a building to have that high of a cancer rate, it was probably the issue in hand. But that's areas, looking for areas that need to be improved. Number 2 was be setting goals related to improvements company that they want to make, meaning what is it they're looking for, what are they trying to get out of it. Again, every single company, every one of your clients, they all have different wants. Every single one, maybe you have one company that wants to do a big loser type scenario, where another one, all they want to know is to teach their employees about how to eat better, bringing healthier foods for their lunch instead of going out and eating hamburgers. Also record progress, meaning that there's somebody at the location has to be responsible for record progress. And number 4 is update the goals of the wellness plan as needed, because when the companies start seeing improvement in one area, they might start wanting to, the other areas will start popping out because it's more visible, because this area has already been taken care of. So you're going to have to be updating on a constant basis. Budget. How many of y'all deal with companies that don't have a budget for wellness? A lot, right? Yeah, so do I. Where is the budget coming from? Do they have a budget? If they do have a budget, what can they do with that budget? If a budget is available, funds need to target key areas of interest or give the most bang for the buck, such as biometric screenings. So the reason why I put that as number 1 is because it not only gives the company but also the employee a basic idea of their true health, meaning, what's my BMI, what's my cholesterol, what's my blood pressure, what's my glucose, am I diabetic, so forth. At least it gives a basic outline of where to start with an employee. Incentives to employees to participate. That's another area where money needs to be implemented. And this could be anywhere from a $25 gift certificate to, you know, a gym or you know, Subways, or it could be just simple recognition. And when I say that type of incentive, believe it or not, recognition, after all, we've done several surveys throughout the years, recognition is number one for an employee to receive. And that doesn't mean, good job, you lost 10 pounds. No, that means getting them in front of their coworkers and really praising them for you know, achieving goals and so forth. That has always been number one. And then of course funds towards a gym membership. And when I talk about gym membership, it just basically means also giving that employee a lot of gyms, like I'm going to just say Gold's Gym, for example, or Lifetime. They typically will go to a company and they want you to either sign some type of contract that says that they're exclusive, they're the only ones that can go in and talk to your employees and so forth. But as a company, why would you want to do that? Because regardless of if you aren't exclusive to them, they're still going to give you a good deal because they want your business. So I always tell companies, you don't have to be loyal to, your loyalty needs to be to your employees, not to the gyms. Because let all the gyms come in and let your employee choose, because we've done surveys, especially with women, where they, some women that do not work out and do not go to a gym. Why do you not go to a gym? They're intimidated, they don't like big gyms, they don't know how to use machines, they don't know how to ask, they just feel very awkward. So these women said they prefer smaller gyms or curves or something that's more women oriented. So if you're being exclusive to a company like Gold's Gym, you're also eliminating a lot of your employees from utilizing that service because they're not going to do it. And so I always say, keep the options open for your employees. And by the way, those companies that do not use some type of incentive program, it's 26% that they have employee participation. So it's always good to have some type of incentive in place. And it goes up like triple. As far as a no budget corporate wellness plan, there's a lot of things that y'all could do for your client if they don't have a budget. I'm going to give you an example of what we do in San Antonio. Kaiser Medical Management takes care of all of Texas, but in San Antonio, we have programs in place that are sponsored by the health industry. And so basically, I went out and I spoke to several health providers, such as Health Crave and some hospitals and so forth, and they sponsor my program to bring to corporations. So when in San Antonio, if a company is wanting a health fair or wellness lectures conducted by doctors, all they have to do is call and they get it. It's free to them because of the fact that our programs are sponsored by the health industry. Outside of San Antonio, we have programs in place with healthcare on call. So if there's a company that has healthcare on call for their employees, they get those services at no cost. So there's programs out there that y'all may not know about, but there's a lot of information, especially with nonprofit organizations, that y'all could utilize. Y'all are probably familiar with the one as far as if you use premium incentives to motivate employees to engage in healthier behaviors or abandon unhealthy ones. For example, offer the employees a credit that they could use to offset their health plan premium contribution in exchange for participating in a health risk appraisal. I'm sure y'all are familiar with that. And I'm sure y'all are familiar with the fact that a lot of the insurance companies have mostly online wellness programs that the client could participate in it. I can't say that I've heard great things about it, but it's a good starting point. My whole concept of it is if you're not in employee space, if you're not getting them engaged physically or in a room such as this, having a doctor talk to them in regards to different aspects of it where they can ask questions. Typically, the online stuff, they're sitting there at a computer and they're reading, and so who do they ask if they have a question? the engagement is not there. So the likelihood of it being a constant thing that they continually do is not going to stay for very long unless you constantly say, have you checked on that, or have you gone to the website, or give them some type of incentives to actually go to that site. And then as far as free resources in the community, for example, local health department may have individuals who could speak to employee groups on seasonal health issues such as flu or other resources such as that. If a company had somebody in place, normally it's a human resource or benefits person that would be in charge of this. And it's really a full-time job. That's why a lot of companies utilize our services. But there are services through nonprofit organizations such as American Heart, American Diabetes, American Cancer. They have doctors and nurses on their board that will come and speak to a company about a particular health topic. And it wouldn't cost the company anything, but you have to, know how to go about it, you have to be able to find it, you have to be able to know who to speak to, you have to follow up with them by email, by phone calls, and so forth. So, but they're out there. Those services are available, and those services are out there. Also hospitals, they also provide, they'll come out and do blood pressure checks for your employees and so forth. At least some of the ones that I deal with in San Antonio. But again, it's a matter of just making phone calls. It's a lot of phone calls. Other things that can be done on a non-budget wellness plan is to try to develop a partner-type relationship with local hospitals, clinics, or other organizations such as the YMCA for free or low wellness activities available to employees. This I went ahead and put on there, and I have my thoughts on it. As far as according to the Alliance of Wellness, ROI, they published an ROI resulting from wellness programs ranging from $1 to $20 for every dollar spent on wellness initiatives. And it's pretty dramatic. It goes from one extent to another. But again, because I deal with these companies on a daily basis, a lot of it really has to do with the fact of, again, what is the company wanting to get out of it? So if there's only a company that's doing a health fair once a year and not seeing a high ROI, well, they're more closer to the dollar because they're not putting in the time and the efforts to engage their employees on a weekly, monthly basis. So the more engaging that the company is, the higher the ROI is. And that's what I see on a daily basis. So when I see this big range, a lot of it has to do with that factor. As far as consistency and accountability, this is huge. Once a corporate wellness program is in place, consistency and accountability is a must. And that means getting employees' feedback. That means, if y'all never heard of surveymonkey.com, it's an online where you can make it's free. You get 10 questions for free that a company could put together, send to their employees by email, they fill it out, and you get the results. And that's basically asking them, how'd you like the wellness lecture? What do you want different? It gets to get some feedback from the employees. Other one is management participation. That is extraordinarily important because if the management's not backing up or the CEO is not backing up a wellness program, that wellness program is not going to go anywhere. And a perfect example of that is there was one particular company that I dealt with where the HR benefits person was overweight, smoked, didn't take care of himself. He was forced to start a wellness program, and you could tell he did not want to do it. And so I dealt with him, and that wellness program went nowhere. And needless to say, the next year, when he was no longer there, another person was in his place. Well, that manager was, ran 5 miles a day. He wasn't a non-smoker. He was a go-getter. But not only was he more engaging and made the employees more engaging, he reflected that towards them. So it made them want to be better, do better, and be wellness conscious on their behalf. So management has a lot to do with a wellness program being awesome or being terrible. Giving recognition and praise to employees that walk the walk, and that's really big. Again, out of all the programs I've seen in place, the number one thing that I've seen that works on a consistent basis that absolutely costs nothing is simple recognition. Saying, Donna, come on up, I want to give you recognition, you lost 5 pounds, and everybody clap for Donna. That is more rewarding to an employee that I've seen over 16 years, and it costs absolutely nothing. And it saves the company a lot just for praising, and I think employees just don't seem to feel like they get that enough. And creating a team player atmosphere amongst employees to encourage one another. I've seen companies do several things. SeaWorld in San Antonio decided as a whole, they have like 500 employees, as a whole, they created a wall, a drawing of Shamu. And Shamu weighed about 2 tons about that time, but they were basically going to have a 6-month lose weight, the same equivalent amount as a whole, as much as Shamu weighed. And so every week, everybody got on the scale and got weighed, and they colored Shamu in a little more, colored Shamu in a little more, and eventually they actually did lose the same equivalent weight as Shamu, so Shamu was completely colored in. And that was one, a team player type atmosphere that got everybody involved. And I've also seen where corporations have done your department against your department against your department, and whoever lost the most weight, it was always money that was involved in those types of programs. And then I've seen some that was just individual, but that actually works, especially in a team type setting, because I know you don't want to let him down. It's vice versa. And if you go out for a hamburger, he's going to know about it. And so that always has worked. As far as providing employees options, employers need to work with all aspects of health and wellness for the good of the employees. My whole concept with my company is bringing the health industry and the companies together for the good of the employees. And it's not about, for example, again, with a gym membership or a health provider being exclusive to them, because then you alienate a lot of your employees. SeaWorld, for whatever reason, has a contract with Chris of Santa Rosa. So when we were contracted to put a health fair, I was told you can't invite any other hospital, Methodist, whatever. And I'm like, okay, what is Chris of Santa Rosa doing for you? They're just going to show up and give out information. I have Methodists willing to do cholesterol screenings for you. I have Baptists that's willing to do this for you. I have this hospital willing to do this for you. And so why would you alienate these other facilities when they're not when all of them are good for your employees? Maybe your employee lives closer to Methodist instead of Chris of Santa Rosa. But my whole standpoint on that aspect when it comes to the bottom line is your employees should be first. And Chris of Santa Rosa would still show up, I promise you, regardless if you have Methodists there or so forth. And same thing with the gyms. They will all come as long as you invite them. And also giving other options for your employees. A lot of employees have high deductibles, and deductibles are just getting higher and higher. It's really hard to sometimes have that money in hand if something really were to happen. So having options, even if the company doesn't pay for it, giving the options to the employees to be able to pay for it themselves on services like the teleservices, or just, for example, what we do with healthcare on call is it's the same concept. They have healthcare on call and they have their insurance. Whatever they're going to save the most money on at the time gets utilized. And so it's healthcare on call and they just pay the difference. That money still goes towards their deductible, but it's less money out of my pocket at a time I don't have it. So it really helps the employee in that aspect of it. So giving the employee more options in that realm. And then again, working with the entire health industry to provide low cost or no cost on-site services to the employees. There are services that could be provided with hospitals and so forth when we bring them out. Whenever we bring out the hospitals to on-sites with corporations, if the hospital says they'll give it for free, we don't charge the company double. I mean, we provide services that the hospital provide, but yeah, they're willing to give it for free, and we get them to give it for free, then it's free. And so, and it's happened before where a hospital would say, well, we just happen to have cholesterol. We got funded by such and such. we could do cholesterol screenings. Well, great. That's money, less money out of your pocket, and it's a service that's being utilized for your employees to find out what their cholesterol level is. And do y'all have any questions whatsoever?
There's some talk about, and I don't know if this is a lot of people, but there's some talk that they may go to a system where they look at a person's BMI, which is what they would use, and if you're over X, well, your insurance premium is going to be the normal rate plus X.
Yeah, I've heard of that too.
Do you think that will really?
I've heard of that too, and I don't know if that's going to move forward with that, but I could see it being something that does get implemented just because of the fact that it's no different. For example, if you get on Southwest Airlines and a person is taking more than their seat, so they're having to pay more, so they're paying for 2 seats instead of 1. And I know that CVS right now is getting a lot of debate because they're kind of twisting their employees to do biometric type screening and so forth, and then they don't do it, you're automatically charged $600 more on your premiums and so forth. So I know that they're getting a lot of heat on that aspect of it. But it's, you know, I could also see that as a lawsuit.
Yeah, so
I
think that's some of the concern. If we do all this screening, are you going to use that against us after we've done the screening?
It's funny that you say that because there's a health insurance company that we were contracted with for many years, and they bought out a medical facility, and when they bought that medical facility provided biometric screenings. Well, that medical facility charged $150 for biometric screenings, and we only charged $75. So you would think it would be smart for them financially to use us instead of the medical facility, but my whole point was they own the medical facility, so I wonder. Yeah, so, you know, they say they don't, but who knows? And any other question? No? Well, you are easy. Well, I really don't have anything else other than that. The only other thing that I wanted to bring up to y'all was there's a company, I don't know if Austin does, if all they are from Austin, but most cities have a program through their you know, like for example, San Antonio has what they call Mayor's Fitness Council. This is another great program that if you're in your city to find out that you could see if they provide programs through the city. This is a walking program, and so it's also one that where they actually come to your company and they start a walking program with the employees and get them moving and so forth. And it's a great program. It's worked so far really great in San Antonio, and I don't know if Boston has one, but definitely look into it because it's worked really good in San Antonio.
In the city of Friendswood, we actually had one of our dispatchers working on masters. They actually started a wellness program as part of our masters, and so we implemented it and ran for about 3 years. And then at the end of 3 years, unfortunately, the only people that were doing it were really the people who really didn't need to do it, because you got jerseys and hats and all these different things. And so management came and said, look, this just is not good use of city funds. The people that we would hope would join are not joining.
Yeah, and again, a lot of that I see, it really, again, it goes back to what I say about management. The company really needs to pick their management really carefully, more so than their employees, because when management has the authority to hire, fire, and so forth, typically management, it is common, it's human nature to hire your life person, meaning that if there's been times I've gone to a company where it's a Hispanic male that smokes and so forth, and everybody is Hispanic, and then when I go next year, it's a different manager, and everybody's. But they hire their life. So if your management is not health conscious or healthy or thinking in that aspect, they typically will hire the same likeness of themselves. And so I've seen it over and over again over 16 years walking into a company, and I know the minute that I speak to the manager that I have to involve myself with, and if they're not in that realm, that program is not going to sustain itself. I would literally have to be there on a daily basis.
Who do you normally work with, Lenore, when it comes to public entities? Do you work with risk management? Do you work with the HR coordinator?
The majority, when we first started 16 years ago, the majority of the calls that we were getting were companies direct, and then it slowly transitioned to brokers, and then it transitioned to insurance carriers. So the two that we get the most are from the brokers are the insurance carriers now that they know about us more so. But originally, 80% or more were from the companies direct calling us.
So as a public entity, can a public entity contact you? And
Absolutely. They can contact our office and schedule time to meet to find out exactly what they're wanting for their corporation. Nowadays, a lot of companies have things in place. They just are trying to make it better or bigger. Like, for example, First Smart Credit Union in San Antonio utilizes us for pretty much everything, but we changed their health fair. They no longer do a typical health fair where you go table to table, kind of like trick-or-treating. they don't do that anymore. But yeah, exactly. It's an adult trick-or-treat. But we do actually a fitness day. So we bring out not necessarily the health industry, but we bring out the Gold's Gym, the Lifetimes, the personal trainers of their little entities that they have, and each one of them, all the employees have to go to one station, do something there, they go to the next station, they do something there, and if they finish it, they get some type of prize of some sort. So it's always done on a Friday because it's a casual day and they get to wear blue jeans and tennis shoes. So.
You ever sustain any workers' comp injuries during those days?
No, not, 16 years I've yet to have one issue. You're ready to sign me up. Yes.
Well, I was just going to say the city of Austin does kind of the same thing you're talking about. But
awesome.
We try to do the cheapest things possible. We set up classes at our offices and in the parks right by all of our big offices. And typically the people teaching the class are employees. Really fit employees.
Exactly.
And if you go to 10 classes, you get 4 hours of admin leave, and they take rows.
That is awesome.
And and so they've got all these little soldiers that have been sent out, and for us employees, we can get admin leave, which everybody loves.
See, and that's a great incentive.
And our firefighters are the ones that give out the flu shots. So
okay.
we do a health fair too, just like I'm sure a bunch of other people do. But
exactly.
we also have flu shots, and our own employees give those.
I'm going to hope that's EMS giving out the flu shots.
I think it's environment too. I think it's EMS is environment.
And we also have Weight Watcher classes where you get it subsidized.
Okay.
You attend like 10 out of 12 classes.
That is awesome. See, there's so many programs that, and again, if management backs it up and if management gets involved in it, you'll see a bigger turnover as far as the employees being involved. I write articles for a magazine in San Antonio. It's an infant magazine, and they utilize me to do the corporate wellness aspect of it. And I wrote an article that has to do with management, and I said, and one of my things that I put on there is that if a company is truly interested in reducing their rates and making things right where it comes to their insurance claims and so forth, they need to implement and grade the management on health and wellness as well as everything else to get a raise. It shouldn't just be, did you have the, did you do this, did you do that, but also in regards to health and wellness, how fit and how well are your employees that you manage? If they would just put that in place with their management to get graded on, it would make a difference in the results they get from it.
Unfortunately, except for a person's fitness to do a particular job, which we send them to screening to make sure they can all the aspects of the job, we don't disqualify somebody who may be out of shape from in a position based on the fact that they're out of shape. And if that's the right candidate for the job based off of their knowledge base and their ability to do the job, if they're 400 pounds or if they're 180 pounds, that doesn't, at least for us, that doesn't play into that, which legally, technically, it's not supposed to.
Exactly.
Now, I'm not saying it doesn't ever happen.
Exactly.
I can guarantee you our workforce is very diverse. We have people of all different colors, creeds, size. It's definitely not a bunch of people that are run out and do marathons anytime soon. But it's a very solid workforce for the most part.
that, yeah,
I'd love to have them be a little more physically fit, but that's not how we base off how we're gonna hire them.
yeah, but it's not necessarily to be, picking up weights and doing, it's just a matter of just eating right, nutrition right. You want these employees to be some basic of health, so that you're
And ideally,
placing
that's not, that's not within the course and scope of our employment of them. And we don't, I mean, even as I was talking earlier today, even with our police officers, who I would love it if we could ever push through, or they had to pass a basic physical every year to be able to run a 7-minute mile or whatever it is. But that's never going to
Or is it
help.
the fire department that has to do that, right?
Yeah, even our fire departments
Really?
have to pass anything. They do an initial test when they first hire in, and that's it. They never
Wow.
have to pass anything again.
Wow. Any other questions anybody has? You way in the back? Hi. Well, if y'all have any other questions, I'll be here for a little bit. I have a business card up here if y'all want to grab one. And I appreciate y'all's time. Thank you very much.
Thanks.